This is Johnny Nelson here. I want to talk about your ultrasling. So if you're scheduled to have shoulder surgery, shoulder replacement, arthroscopy, very likely we'll be getting one of these special slings here. These slings are essentially two different pieces, so I don't want you to get confused on the two different pieces. The first most important piece obviously is the sling itself. This is the part that we all know and love that the arm actually rests in. And we're going to show you kind of how to put that on to start with. So the best way of doing that is starting with the sling free. Don't worry about the straps. Basically you want to slip your hand into this portion of the sling because it has the open hand end and the elbow end. You want to make sure that your elbow is resting nice inside the sling down here at the back, so the point of the elbow is all the way back. Proper sizing of this, you want the edge of the sling to actually cradle the outside of your hand. If it's sitting out here on your forearm, then it's too small for you, so you really kind of want it to support your hand a little bit. So that's how you get your arm into the actual sling. This strap over here towards your elbow is the one that comes around the back of your neck and is actually going to be doing most of the supporting for you. Keep in mind that the pad here is for your neck. This is also adjustable and can slide back and forth along the strap so that it's a nice, comfortable position for you. If it's too low, if it's too far back this way, it's not going to be padding the neck for you. There's a few different straps on this portion of the sling. There's one here that goes around your hand between your thumb and your index finger. It's very important, especially immediately after the surgery, you check this area frequently because most of you will have what's called a nerve block to your arm. And sometimes if this is too tight on your hand after the surgery while your arm is still numb, it can actually cause skin ulcers and breakdown in that area. So make sure this is not too tight in there. The other strap here that you often find on the outside of the sling, I will show you, that's related to the second part of the sling. So this is often called a pillow, an abduction pillow. And the main thing that this pillow does, it has two main purposes. Number one, it holds your arm a little bit away from your body, right? So it actually abducts your shoulder, holds it a little bit away from your body. It also keeps your arm from falling backwards. So the main place that you put this pillow is not under the arm. Some patients come in and this is under their arm, like their arm is just resting on it. That's not right. This actually goes between your arm and, your body and the sling portion. So it's a pillow that goes between your arm and your body. All right, so you basically fit it with the Velcro that's on the inside of the sling here to the Velcro that's on the pillow. And then this strap also is present on the pillow. This strap actually goes around your body here and attaches onto the other end of the pillow. And the main purpose, as you can see here, is not only is it holding the arm slightly away from the body, but it's also keeping the arm from falling backwards. So those are the two main two main parts of the sling, and hopefully that clarifies a lot of the questions that you might have. This last little piece of strap right here is actually meant to hold the sling portion to the pillow, so you can kind of wrap this around the pillow. It kind of secures and gives an added layer of security and keeping the two portions of the sling together. All right, so common questions we often get about slings is about the straps, also about the pillow. So about the strap, remember the main reason you're wearing a sling after a surgery is you want a reminder for you and for others, in addition to give you support of that arm that you've had recently operated. It's also a good reminder not to use the arm and do too much with the arm. So that being said, it is okay in certain situations to take the straps off, right? So say for instance, you're sitting on the couch, you've got some pillows under your arm, and you want to just give your neck a little breather. It is absolutely okay for you to take this strap and just let it hang to your side, okay? That is certainly okay. You can even take your sling off altogether, and as long as you're doing and holding your arm in that sling position, it's also okay for you to just give your arm a rest outside of your sling. You're sitting in bed, sitting on your couch, that is also okay. The other question we often get too is about the pillow, right? Can I take the pillow off? The pillow's driving me crazy, I hate the pillow. Yes, that is okay to take the pillow off. The pillow itself is not the main action portion, but it does serve a purpose. Usually it is fine for you to take the pillow off. One thing I will say is the pillow does help to keep your arm from falling backwards, right? So if you do take the pillow off of your sling, you may need to build some pillows up from your house or blankets under your elbow to keep the arm from falling backwards, right? But definitely taking the pillow off or undoing the strap from the pillow is certainly okay to do after the surgery. But the main reason the pillow is helpful is it does keep the arm from falling backwards, so it immobilizes the shoulder in a different way. And of course, keep in mind you can always adjust the straps here on the sling itself. The sling should be holding a little bit of upward pressure on the arm. So if you find that you feel like your arm is just hanging, you want to increase that pressure a little bit so that when you let your arm fall by your side, it feels like that sling is actually holding that arm up a little bit, because the main purpose here is to increase the support for your arm for the sling. So hopefully that's helpful. If you have any other questions, of course, ask me before or after your surgery, give us a call, or just watch this video again. Thank you so much.